Obesity in the United States has reached a record highs. In the early 1990s, only about 11% of Americans were obese. Today, that number is 42%, with some states approaching 50%. This isn't just about body size. This is about health, longevity, and quality of life. So today, I'll walk you through why obesity has skyrocketed, what medical conditions it causes, the most effective weight loss treatments, and practical thought process to help anyone lose weight safely and sustainably. Since the 1990s, obesity rates in the US have climbed every single decade. Why? Highly processed, calorie-dense foods became cheaper and more available. Sedentary jobs and lifestyle increased. Larger portion size became normalized, like the supersize. Chronic stress and poor sleep disturbed metabolism. Easy access to sugar-sweetened beverages. This combination has created an environment where weight gain became the default, not the exception. What you have to know is obesity is not a cosmetic issue. It's a medical disease. It increases the risk of type 2 diabetes, hypertension, heart disease and stroke, fatty liver, which is actually the leading cause of liver transplant, sleep apnea, osteoarthritis, and several cancers including colon, breast, and uterus. The more severe the obesity, the higher the risk and the earlier these conditions actually begin. The basic truth is, excess body weight shortens life expectancy by 5 to 10 years, depending on the severity. But here's the good news. Losing just around 5 to 10% of your weight significantly improves diabetes, blood pressure, sleep apnea, liver inflammation, and joint pain, meaning even small changes are powerful. Diet and exercise form the foundation. But here's the truth. Most people can lose weight with diet. The real challenge is maintenance. Studies show that with diet and exercise, weight loss of 5 to 10% of body weight can be achieved. Long-term maintenance, only 20 to 30% of the people maintain that loss at 3 to 5 years. That means most of the people would end up with a yo-yo, trying to go back up and down if they want to lose weight again. Why? Your body fights weight loss by lowering metabolism and increasing your hunger hormones. So diet and exercise are essential, but often not enough alone. So what are our options? Well, now we hear a lot of other medications to actually help you lose weight. One of this is actually Ozempic. We have Wegovy and Mounjaro. Medications like semaglutide and tirzepatide have changed the landscape. The average weight loss using this medication is 15 to 22% of total body weight. It helps control hunger and stabilize blood sugar. However, there are going to be side effects. One includes nausea and vomiting, constipation, gallstones, delayed gastric emptying, rare but serious pancreatitis. People have to take it forever? Well, for most, yes. Obesity is a chronic disease. However, the problem is when people stop, they regain 50 to 100% of the weight loss within a year. So, how do they maintain the weight if they discontinue the medications? This entails a lifestyle change, eating high-protein diet, strength training at least 2 to 4 times a week, possible step down on the medication, slowly tapering it, behavioral therapy, or considering endoscopic or surgical options for long-term stability. So what are endoscopic options? Well, endoscope is basically a transoral scope in which an intervention can actually be performed. And so there are two. One is a gastric balloon, wherein they put a scope and then inflate a balloon inside your stomach to help you feel full most of the time. This decreases the capacity of the stomach for the food and helps provide that sensation of fullness. What is the result? Excess weight loss of 10 to 15%. It's removed after 6 months. It's good for temporary weight loss. There's a high regain without long-term support. What are the risks? Nausea, reflux, balloon migration, and early removal. So what's the other one? The other one is endoscopic sleeve gastroplasty, which is gastric suturing. So when we do a bariatric procedure like a sleeve gastrectomy, which we take part of the stomach and then make it into a tubular structure to decrease the amount it can take, they discovered that by actually suturing the stomach from the inside, you may achieve something similar. What's the result? Well, their excess weight loss is between 15 to 20%. It's more durable than balloons. It's an outpatient procedure, although it is not as powerful as the surgical options. Now moving from endoscopic to bariatric surgery. Surgery is the most effective and durable treatment for obesity. There's going to be certain types which are more commonly performed. Most common one currently is the sleeve gastrectomy. What you do is the stomach, 80% of the stomach is actually removed, turning it into a tubular structure. This provides an excess weight loss of 50 to 60%. It overall has a low complication rate. Cons, it is not reversible, and there is a long-term risk of reflux, especially with those patients who have reflux to begin with or have a hiatal hernia. The next procedure is something more extensive. You probably heard it. It's the Roux-en-Y gastric bypass. So what happens is most of the stomach is divided at the proximal aspect, leaving a small pouch. And then your small bowel is divided and reconnected, creating a roux limb, which has no enzymes until it meets down the other limb, which is your biliary limb, wherein absorption just starts. So it creates a segment which bypasses the absorption of nutrition, therefore decreasing the amount overall absorbed. And at the same time, this produces a deficit, helping you to lose weight. What does it achieve? It achieves an excess weight loss of 60 to 75%. It is best for severe reflux and diabetes. What are the risks? Well, it's a more extensive procedure and it is associated with nutrient deficiencies, dumping syndrome, and risk of internal hernias. Which is more sustainable? Both are effective long-term if combined with nutrition follow-up, vitamin supplementation, behavior changes, and physical activity. They remain the most reliable option for decades losing weight control. So, how should people think about weight loss? If you're struggling with weight, here's a simple framework. Start with lifestyle, high-protein diet, strength training, sleep, and stress management. If lifestyle isn't enough, you can add medications, especially if you have diabetes, PCOS, or a BMI more than 30. Consider endoscopic options for moderate obesity, especially between the BMI of 30 to 40. Consider surgery for BMI more than 40 or more than 35 with comorbidities. This gives the best long-term outcome. Understand this. Weight loss is not about willpower. It's about biology, environment, and picking the right tool. You deserve the method that gives you the highest chance of success and long-term health. If you guys liked the video, please click the like and subscribe button. And if you guys have any questions, type in the chat and check out the other videos.